Andy Hetzel from Blue Cross Blue Shield of Michigan is on the other end of our line this morning. He's the Vice President of Corporate Communications. Good morning to you.
Michael, I'm pleased to be here. Good morning.
Thank you very much. When the President comes in, I was just reading U.S. News and World Report, and Mort Zuckerman, who've been talking about this all morning, says that the President has a 45% approval rating. And there's widespread feeling that government doesn't work, that government is incapable of solving Americans' problems. That's what Mort Zuckerman says. And one of the reasons, he says, is the misdirected health care program. Now, not to pick on health care, because he also cites, Wall Street and the general feeling that Washington can't solve people's problems. They also don't like the stimulus program, which was necessary but maybe ill-conceived. But when they start talking about the misdirected health care program, I know that gets your attention. What do we need to know from a Michigan standpoint, with Michigan's Blue Cross Blue Shield of Michigan, a major employer in our state, and the President Obama and the health care reform program?
I think what your listeners need to know from our perspective, Michael, is that now that the reform bill has become law, we've moved past the debate, and yes, the debate is continuing in political circles, but at Blue Cross, we see it as our responsibility, now that the law has been put into place, to work as partners with the government to help it become implemented successfully. That's what people really need to count on. They need to count on private insurers like Blue Cross stepping up to the plate, really delivering on the success of healthcare reform. And as part of that process, Michael, we know that a lot of folks in Michigan are confused about the changes, how the changes impact them. They're going to impact people differently depending on their circumstances, depending on if they're doctors or if they're patients or if they're, if they work at a hospital. So one of the things that we've done is launched a website at bcbsm.com/healthreform that we are providing almost daily updates to, in terms of the latest information that people need to know about the changes in healthcare that healthcare reform is bringing forward. And we're encouraging your listeners to go there on a regular basis at bcbsm.com/healthreform and find out more information. And folks can ask questions on that site that we'll be happy to answer.
Oh, really? That's terrific. So when
it's really interactive, Michael. It's it's part of our initiative. We're doing it through healthiermichigan.org, which is the website that we launched earlier this year. We're doing it through this website on health reform. We're trying to be very interactive with folks. Healthcare is changing fast. People have questions. We're here as a trusted resource to help them answer them.
And obviously that's not with any political bias. You're down to business because this is the law as it's going to be, and you're going to have to implement it here in the state of Michigan. So when people hear political rhetoric one way or another and they want to have a clean look for themselves from a Michigan perspective, they can go to bcbsm.com/healthreform.
That's correct.
Yeah, BCBSM stands for Blue Cross Blue Shield of Michigan if you're writing it down at home or you want to remember it. Hopefully you're not texting it into your BlackBerry while you're driving right now, but we'll put it on our website, MichiganTalkNetwork.com, so people can link through that. Just go under the podcast section for this interview with Andy Hetzel, and you'll be able to link right through. BCBSM.com/healthreform if you want the sort of unfiltered version from a Michigan perspective. Thank you very much, Andy Hetzel. We'll say hi to the President for you on Thursday. It's 14 before the hour. Michael Patrick Shields.